Hi, I'm Hayley Chidlow, and this is a case study of a 12-year-old thoroughbred mare who presented with acute onset epistaxis from the right nostril. The owner reports that there was a large volume of blood when she first found the mare, but there is now only a trickle from the right nostril. The mare is reported to be otherwise fairly bright in herself. So my approach here is to start with a complete physical examination. Particular areas to focus on include heart rate, which if increased could reflect pain or hypovolemia or anemia from blood loss, as well as checking the mucous membranes for colour and for evidence of petechiae, which could indicate a clotting disorder. I also want to check carefully for any signs of head trauma. In this case, the mare had a normal examination with a heart rate of 44 and pink mucous membranes. There was blood on the walls in her stable, but no evidence of trauma to her head. Now, what should be the next step of our diagnostic investigations? So for me, endoscopy is by far the most valuable tool in investigation of epistaxis. It allows you to evaluate for the source of the bleeding by looking at the nasal passages, ethmoids, sinus drainage angles, pharynx, guttural pouches, and trachea. With unilateral epistaxis such as this, typically this indicates bleeding from the upper airway, with potential differential diagnoses including ethmoid hematoma, sinusitis, and guttural pouch mycosis. Lower airway hemorrhage, such as exercise-induced pulmonary hemorrhage, typically results in bilateral epistaxis, but it can appear unilateral in some occasions. So this video shows the endoscopic examination for this mare. So we're passing through the nasal passages, through the middle meatus, in order to enter the pharynx. And so we can see a little bit of blood as we go along, but now as we enter the pharynx, we can see a large volume of blood coming from the right guttural pouch ostium. This is an immediate cause for concern because it makes us consider guttural pouch mycosis with erosion of the internal or external carotids arteries. So this becomes our top differential diagnosis. So if you are scoping this horse in the field and see this, it would be grounds for immediate referral. I do not recommend trying to enter the guttural pouch with the scope if you see this, as currently the bleeding is not active, but it is very easy to dislodge a clot and cause another bleed. Most horses with guttural pouch mycosis will have 1 to 3 episodes of bleeding before having a catastrophic fatal bleed. So we don't want to risk this happening without having the horse at a hospital with the surgical facilities required to treat the mycosis. The surgical options very much vary depending on the hospital that the horse is referred to and the surgeon preference, but some of the options include balloon catheterization or transarterial coil embolization. Medical treatment or standing surgery to perform a salpingopharyngeal fistula are not appropriate for horses that have already had a bleed, as the time taken for both of these treatments to have any potential effect is too delayed, and the horse is likely to have another potentially catastrophic bleed in the meantime. So the aim should be to transport this horse safely without raising the blood pressure. So if needed, it can be useful to administer acepromazine or even a small dose of sedation, romifidine or dotomidine, just to ensure that the horse doesn't become stressed or raise its blood pressure or potentially traumatize its head during transport, which could result in more bleeding. If you have tranexamic acid, which is an antifibrinolytic and which helps blood clotting, then this can also be given.